ACE Personal Trainer Manual, 5th edition, Chapter 1, starting on page 7. The ACE Personal Trainer Certification. The decision to pursue certification as a personal trainer is an important step in being recognized as a competent professional. The ACE Personal Trainer Certification Program was developed to assess candidate competency in making safe and effective exercise program decisions for apparently healthy clients. Candidates who achieve a passing score on the ACE Personal Trainer Certification exam meet or exceed the level of competency required to work as a professional personal trainer with minimum supervision. In the credentialing world, this threshold of professional competence is referred to as the minimum competency required for a person to work in the profession. The primary purpose of a certification is always to protect the public from harm by assessing if the professional meets established levels of competence in the knowledge, skills, and abilities necessary to perform the job in a safe and effective manner. For the professional, a certification can separate him or her from others who have not proven themselves to be at the same level of competence. Fitness professionals who earn the ACE Personal Trainer certification are competent to work as professional personal trainers for apparently healthy individuals, clients with special needs who have a physician's clearance for exercise, and small groups with minimal supervision. This does not mean that an ACE certified personal trainer knows everything there is to know about personal training. Just as successfully passing one's medical board exams does not mean that the individual knows everything there is to know about medicine. Instead, by earning an ACE Personal Trainer certification, the professional has proven his or her competence in applying knowledge to make safe and effective exercise programming decisions in a variety of practical situations while minimizing client risk and exposure to harm, e.g. physical, emotional, psychological, financial, or other harm. Defining scope of practice. A scope of practice defines the legal range of services that professionals in a given field can provide, the settings in which those services can be provided, and the guidelines or parameters that must be followed. Many factors go into defining a scope of practice, including the education, training, and certifications or licenses required to work in a given field, the laws and organizations governing the specific profession, and the laws and organizations governing the complementary professions within the same field. Most laws defining a profession are determined and regulated by state regulatory agencies, including licensure. As a result, the scope of practice for licensed practitioners can vary from state to state in a given profession. In addition, most professions have organizations that serve as governing bodies within the profession that set eligibility requirements to enter educational programs or sit for certification exams and establish codes for professional conduct and disciplinary procedures for professionals who break those codes. The laws, rules, and regulations that govern a profession are established for the protection of the public. The laws governing a personal trainer's scope of practice and the ramifications faced by trainers who provide services that fall outside the defined scope are detailed in Chapter 17. The eligibility and certification requirements to work within this legal scope of practice are defined by the professional organizations that offer personal trainer certifications. These organizations also establish codes of ethical conduct and mandate that they are upheld by certified professionals and applicants in all actions related to personal training. It is crucial for personal trainers in every industry to be aware of the scope of practice for their given profession to ensure that they practice within the realm of the specific education, experience, and demonstrated competency of their credential. Key concept. Scope of practice for ACE certified personal trainers. Personal trainers as a collective group have a general scope of practice, as laid out in Table 1-2. While this table provides general guidance, each professional must know what is within the specific scope of practice for his or her credential. The ACE Certified Personal Trainer scope of practice is presented in Figure 1-2. ACE Certified Personal Trainers must work within this defined scope of practice to provide effective services to their clients, gain and maintain support from the healthcare community, and avoid the legal ramifications of providing services outside their professional scope. Personal trainers should never provide services that are outside their defined scope of practice. For example, a personal trainer may be asked nutrition questions by clients wanting to reduce weight and/or body fat. Personal trainers can help clients with their weight loss goals by designing effective exercise programs that bring about positive body composition changes and helping them to adopt more healthful behaviors. This can include showing clients how to utilize the tools available at www.choosemyplate.gov or educating them about the recommendations in the dietary guidelines to help them gain a better understanding of healthful foods and make better choices, USDA 2010. Clients who are looking for more detailed nutritional programming, such as specific meal plans, recipes, or recommendations for nutritional supplements, should be referred to a registered dietitian, as these services are beyond the scope of practice of personal trainers and are in the legal domain of services provided by registered dietitians in most states. There is overlap among professions within the healthcare field that must be understood if fitness professionals are going to stay within the realm of their professional qualifications and training. For example, the same registered dietitian who can create specific meal plans for the clients can also provide general guidelines about exercise to help them understand the important role that physical activity plays in improving health and creating a negative energy balance. However, if a client working with a registered dietitian wants a thorough exercise plan, he or she should be referred to a qualified personal trainer. A personal trainer should not make recommendations that contradict those of the client's healthcare team. For example, if a client's physician's release has specific guidelines for exercise intensities, modalities, or exercises, the trainer must follow these guidelines when designing the client's exercise program. While the physician generally will not have the same knowledge about specific exercises as a personal trainer, the physician's guidelines will be based on the knowledge of the client's health, medications, ailments, injuries, and diseases, and must be followed for the health and safety of the client. Each state, province, and country has specific laws about the responsibilities of different healthcare professions. It is the responsibility of the personal trainer to learn and adhere to the laws in his or her geographical area, as well as adhere to the ACE Certified Personal Trainer scope of practice. Page 10, Figure 1-2, ACE Certified Personal Trainer Scope of Practice. The ACE Certified Personal Trainer is a fitness professional who has met all requirements of the American Council on Exercise to develop and implement fitness programs for individuals who are apparently healthy or have a physician's release for exercise. The ACE Certified Personal Trainer realizes that personal training is a service industry focused on helping people enhance fitness and modify risk factors for disease to improve health. As members of the allied healthcare continuum with primary focus on prevention, ACE Certified Personal Trainers have a scope of practice that includes developing and implementing exercise programs that are safe, effective, and appropriate for individuals who are apparently healthy or have medical clearance to exercise, conducting health history interviews and stratifying risk for cardiovascular disease with clients in order to determine the need for referral and identify contraindications for exercise. Administering appropriate fitness assessments based on the client's health history, current fitness, lifestyle factors, and goals utilizing research-proven and published protocols. Assisting clients in setting and achieving realistic fitness goals. Teaching correct exercise methods and progressions through demonstration, explanation, and proper cueing and spotting techniques. Empowering individuals to begin and adhere to their exercise programs using guidance, support, motivation, lapse prevention strategies, and effective feedback. Designing structured exercise programs for one-on-one and small group personal training. Educating clients about fitness and health-related topics to help them in adopting healthful behaviors that facilitate exercise program success. Protecting client confidentiality according to the Health Insurance Portability and Accountability Act, or HIPAA, and related regional and national laws. Always acting with professionalism, respect, and integrity. Recognizing what is within the scope of practice and always referring clients to other healthcare professionals when appropriate. Being prepared for emergency situations and responding appropriately when they occur. In Chapter 1 on page 9, Table 1-2 lists a personal fitness trainer scope of practice. I will read that and then move on. Personal fitness trainers do not diagnose, but they do receive exercise, health, or nutrition guidelines from a physician, physical therapist, and registered dietitian, etc. They do follow national consensus guidelines for exercise programming for medical disorders. They do screen for exercise limitations. They do identify potential risk factors through screening. They do refer clients to an appropriate allied health professional or medical practitioner. But remember, personal fitness trainers do not diagnose. Personal fitness trainers do not prescribe, but they do design exercise programs, and they do refer clients to an appropriate allied healthcare professional or medical practitioner for an exercise prescription. Remember that personal fitness trainers do not prescribe. Personal fitness trainers do not prescribe diets or recommend specific supplements. But personal trainers do provide general information on healthy eating according to the MyPlate food guidance system. They do refer clients to a dietitian or nutritionist for a specific diet plan. But remember that personal fitness trainers do not prescribe diets or recommend specific supplements. Personal fitness trainers do not treat injury or disease. Personal fitness trainers do refer clients to an appropriate allied health professional or medical practitioner for treatment. They do use exercise to help improve overall health, and they do help clients follow physician or therapist advice. However, they do not treat injury or disease. Personal fitness trainers do not monitor progress for medically referred clients, but they do document progress, report progress to an appropriate allied health professional or medical practitioner. They do follow physician, therapist, or dietitian recommendations, but they do not monitor progress for medically referred clients. Personal fitness trainers do not rehabilitate, but they do design an exercise program once a client has been released from rehabilitation. I'll read that one more time. Personal fitness trainers do not rehabilitate, but they do design an exercise program once a client has been released from rehabilitation. Personal fitness trainers do not counsel, but personal fitness trainers do coach, provide general information, and refer clients to a qualified counselor or therapist. Once more, personal fitness trainers do not counsel, but they do coach, provide general information, and refer clients to a qualified counselor or therapist. Personal fitness trainers do not work with patients, they do work with clients. Chapter 1, continuing on page 11. Expand your knowledge. Using the exam content outline as a study tool. The ACE Personal Trainer Exam Content Outline is a valuable tool for candidates preparing for the ACE Personal Trainer Certification Exam. It is the result of an in-depth job analysis conducted with a panel of personal training subject matter experts that was then validated via an industry-wide survey. The final ACE Personal Trainer Exam Content Outline presented as Appendix B of this manual is the blueprint used in assembling each ACE Personal Trainer exam. Candidates are encouraged to refer to this exam content outline as they prepare for the ACE Personal Trainer exam, as it details the key concepts and competencies assessed by the exam. It does not provide the exact questions on an ACE exam, however. It does provide the 4 main content domains assessed by the exam and the percentage of questions that come from each domain. The ACE Personal Trainer exam is broken into the following domains. Client interviews and assessments, 31%. Program design and implementation, 33%. Progression and modifications, 19%. Professional conduct, safety, and risk management, 17%. Each domain is comprised of 3 to 4 tasks that are essential for a health and fitness professional to perform competently in order to meet the required level of competence to earn the ACE Personal Trainer certification. Domain percentages represent the criticality of the tasks in the domain and the frequency with which a personal trainer will perform them. The following steps should help you use the exam content outline in preparing for the ACE Personal Trainer exam. Review the 4 exam content domains and their associated percentages. This will help you determine the relative weight of each domain on the total examination. Review and understand each task statement. Each question on the ACE Personal Trainer exam is associated with one of the 15 task statements, as these have been identified as the critical tasks. As well, qualified personal trainers must perform consistently to provide safe and effective exercise programming. I will read that again because I messed it up. Review and understand each task statement. Each question on the ACE Personal Trainer exam is associated with one of the 15 task statements, as these have been identified as the critical tasks a qualified personal trainer must perform consistently to provide safe and effective exercise programming. Review the knowledge and skills statements associated with each task. These describe the knowledge and skills in which a health and fitness professional must be competent to perform the essential tasks of an ACE certified personal trainer. Refer back to the exam content outline as you study to ensure that you have learned knowledge and skills necessary to perform the essential tasks of a well-qualified personal trainer. Refer back to the exam content outline after completing the online sample tests to review the concepts and competencies covered in any domains that have been identified as areas of focus as you continue your studies.